Welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us. Our guest for this segment is a pioneering healthcare business leader, a physician, a seasoned entrepreneur, and a passionate advocate for disrupting the healthcare industry. He's co-founder and CEO of Bright.md. Welcome to the program, Dr. Ray Costantini. How are you?
Very well. Good morning to you. How are you doing?
Doing well. Thanks for asking. Well, as a pioneering healthcare business leader, let's talk a little bit about your background and Bright.md.
Sure. I've got a kind of a complicated background. I had a long history in entrepreneurship, actually even before getting into healthcare, and really shifted into the healthcare industry because I was truly excited about the space and about healthcare as a whole. There's as much a calling as anything. And then I got my medical degree and practiced and really felt like there was a need for folks with experience on the clinical side of the house to help reshape the industry and hopefully make it better. So that's what really brought me to the executive side of the industry. Worked at a large healthcare delivery system on the West Coast, helped build out their digital health services group, brought in some pretty exciting products into that organization, and then really recognized that some of the tools that were out there really weren't meeting the underlying needs that the industry was facing. And that was a big part of the inspiration for Bright.md.
Now, in addition to all of that, you're also a national speaker on healthcare, telehealth, patient engagement, and things of that nature. Where did you find the time to launch Bright.md? Entrepreneurship is often a calling of passion also. You find the time for those kinds of things. Mm-hmm. So it was, like I said, it came from this desire to help make healthcare better and really recognize that a lot of the tools, especially around telehealth, really weren't solving the underlying needs that healthcare was facing. And when you look at some of it's kind of funny to be in a time in healthcare where you can talk about traditional telehealth. It means the industry is moving faster than it ever has before to be able to say something like that. But when you look at traditional telehealth tools, they're really built to solve a problem of geography. Patients and providers are distant from each other. It's a pain to deal with traffic and parking and waiting rooms. And so we'll connect via video to change the location of care. But what really the healthcare system is facing is a challenge around supply and demand. The reason why patients don't have the access to care that they'd like is rarely because of geography. It's because there isn't enough provider capacity to go around for patient needs. We've got about a 25% shortfall between the number of primary care providers, the capacity that they can provide for care, and what's the patient demand is today, and that's growing every single year. So what Bright.md was built to do is to take a very different approach. And rather than just thinking about how do we make care more convenient, we certainly wanted to do that as well. But our focus was on how do we help make it more efficient? How do we help providers spend more of their time at or near top of licensed practice? How does Bright.md, do you offer a platform for telehealth, or do you consult? Or is it a combination of both of those, or much more?
We are primarily a software company. We build software that helps automate that care delivery process. A good way to think about us is think of us as a virtual medical resident. When we talk with healthcare delivery systems, that's usually something they're pretty familiar with. And if you think about what a resident does, a big part of their job is gathering and organizing information and putting it in a format that is easily consumable by their attending physician. They're not licensed to deliver care, but they're there to help support that process.
And so we do something very similar. We start the patients at home. They have got one of more than 400 conditions that we help support care for. They reach out to their healthcare delivery system who has licensed our software product. And instead of having to come into the office after having waited days or weeks for that appointment, they're able to go right there onto their smartphone or onto their computer. And our system starts that process right there. And the first thing that it does is it goes into the electronic medical record system and pulls out all the information about that patient that's relevant to their care. Demographic information, clinical information, meds, allergies, problem lists, the things that are really key to understanding the patient's care needs at that time. And then we use that to be able to, through our advanced technology, we're able to adaptively, dynamically interview the patient for the provider. Providers spend about 30% of their time gathering information that they know that they needed before they even walked into the room with the patient. And so we're gathering all of that for the provider. Once we've gathered that, and again, we do this in a very personalized way, we're learning about the patient as we go through that process. We try really hard not to ask dumb questions. There is such a thing as a dumb question. I tease about the frustration I end up feeling every time I get asked whether I'm pregnant. I'm still not pregnant. Probably won't ever be pregnant. But it's much more in depth than that. It's really understanding their situation and being able to dive deeper into areas that are clinically relevant and not ask questions that aren't. And then we take all of that information and we synthesize it into the format that the providers expect and need, which is a chart-ready note in the SOAP note format. So all written out in the form that they've written tens of thousands of. We create a differential diagnosis, what's likely to be wrong with this patient. We have suggestions around treatment that are all evidence-based and supported. We do order entry, prescriptions, billing files, personalized patient education material, and we give all of that to the provider so that now instead of spending 2 out of every 3 hours doing administrative work, they're now able to focus their attention on instead of creating that content, they're now a reviewer of content. They can look at that information, decide if they need any additional information, but then move forward. And the vast majority of the time, we've been able to gather more than they would have in an in-person setting because we're not time constrained. And so we give that to them. They're able to review that and deliver more thorough, more evidence-based care that has better patient and provider satisfaction scores. And they're able to do that in about 2 minutes of provider time rather than the 20 minutes that it typically takes them in an in-person or video-based setting.
And with all of the ratings that are required for compensation that is increasing, mm-hmm. This goes directly toward the patient satisfaction, the outcome, and the physician's rating as well. Where can we go online and learn more about Bright.md? I guess Bright.md.
So you can go to Bright.md. That's exactly right. So that is our website. We've got delivery systems, even more important than our own website, we've got delivery systems across the country who are offering the SmartExam product to their patients. We had delivery systems offering it to their established patients. Interestingly enough, it's been a really powerful tool for delivery systems to also use for new patient acquisition. I think that's a really important piece for delivery systems to be thinking about. Patients expect convenient care, and their choices of where to go to get that are increasing all the time. We've actually seen one of our delivery systems, 30% of their SmartExam patient visits have actually been with new patients. So it's it gives you a sense of just how much of a pull that kind of convenient, low-cost, high-quality care can be for a delivery system.
Well, it's always great to hear about innovations, especially where those innovations relate to efficiency in healthcare. Thank you, Dr. Ray Costantini. It's been a pleasure, and I'm hoping that we'll talk again in the future.
A pleasure as well. Thanks so much for making the time.
You've been listening to Health Professional Radio, this health supplier segment with Dr. Ray Costantini. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.